Hi everyone, my name's Andrew Bell. I'm joined today by Dr Nasir, who is the Medical Supervisor of Regenerative Treatments here. First of all, just like to thank everyone for joining us today. And while we wait for a few others to log on, we're just going to quickly talk about what we're going to be discussing in today's session. As you know, we're here in Bangkok and we're going to be talking about epidural stimulation. We'll start with Dr Nasir, who will talk a little bit about the treatment, and he will answer some frequently asked questions about the treatment and any other questions that anyone else has to ask. I will then go on to talk about my experience of epidural stimulation, how I came about to hear about the treatment, and the experiences and progresses I've seen to date. And then from then we will answer any questions that anyone may have. So whilst we're chatting away, if you have any questions, please feel free to put them in the comment box and we will answer them the best way we can at the end of the session. So if I just pass it over to Dr Nasir.
Well, thank you everybody for your time. My name is Nasir and I'm actually part of the medical team here. And I'm one of the doctors who are overseeing Andrew Bell's treatment in Bangkok. In the later section of this video, we will definitely be able to answer all the questions. But before this, I would like to explain a little bit what the epidural stimulation is. So basically, epidural stimulation is a process which is aimed to stimulate specific spinal nerve segments. So in this treatment, we implant a number of electrodes over specific spinal segments. So specifically speaking, this is the part of the spinal cord which is responsible for controlling the muscle activity in the legs. So after we implant the electrodes, these electrodes are connected through a little battery machine which is called initial pulse generator, and this initial pulse generator is giving low frequency electrical currents to this part of the spinal cord, and ultimately we are able to gain a voluntary muscle activity. So the process is actually, it involves a surgery plus a comprehensive rehab plan and mapping plan. So mapping is a process after the surgery. Mapping is a process which is used to enable patients, which is used to train patients to control their muscles. So before the surgery, we do an electromyography, which is used to record muscle activity, electrical activity in the muscles, and we use the EMG findings after the surgery to target the voluntary muscle control. So basically, we will use the EMG findings in the mapping process, and we will be finding specific electrical currents patients' muscles are responding to. So this is actually a very comprehensive process, and the hospital stay is around 40 days, which involves the surgery and the mapping process. And during those 40 days, patients are also being trained how to use the device, how to operate the device, and how to continue rehab after the surgery.
So basically, from what Dr Nasir is saying, I personally, obviously, as many of you will know, have had the treatment. Unfortunately, last year on May the 20th, I was involved in a road traffic accident on my motorcycle, and amongst a lot of other upper body injuries, I have damaged my spinal cord, which initially had left me at level T3 complete. And then after a few weeks in hospital at home, I was then diagnosed as T6 complete. Personally, my initial response was to ask, has anyone in my position ever walked again? And I was told a very small number, a very lucky few, may be able to walk as a complete spinal cord injury patient, and personally for me that was all I needed to hear. And despite my prognosis, I was undeterred by the fact that I was told quite quickly that I would never walk again and I would be in a wheelchair for the rest of my life. Personally, I like a challenge, and I took that challenge on face first and instantly started to do research for treatments that would help repair, regenerate the spinal cord and help people like myself or incomplete injuries to try regain their motor functions and start to walk again. And then that led me to find about epidural stimulation and about the hospital and the treatment that Dr. Nasir has just explained. So the process from then was for me to contact the team and complete the medical form so they could evaluate my own injury, check my MRIs and see whether I would be a viable candidate for the treatment, which thankfully for myself I was. And then I went through a rigorous process of a lot of questions, both myself and family, about the treatment with a patient representative who were extremely friendly, extremely helpful, and like I'm sure many people's friends, families and people themselves who've had the injuries, there are a lot of questions involved, and you want to make sure from a safety perspective that first off that the treatment is safe, and obviously from other avenues that you want to know about. So as a family and myself, we went through that process and we were very happy with everything and decided to go ahead with the treatment. From then I was picked up in Bangkok and taken to the hospital and began my procedure and my treatment, which lasted just over 40 days, as Dr. Nasir has explained. The process itself was made very easily. It was explained rigorously to myself and I knew exactly what was going to go ahead, and I had the procedure on the 20th of November, and 3 days later we had our first mapping process with the therapist team where we turned the stimulator on and I was asked to lift my right knee to see if the motor functions had regained and the stimulator would work. Thankfully for myself, I could very easily and instantly lift my right knee to my chest, and then my left knee and right knee and left knee. And as any spinal cord injury patient who's told they would never wiggle a toe again, for that to happen instantly was an indescribable feeling, if I'm brutally honest. But to see it back afterwards and to then send home to family, friends and loved ones, it was a very special moment. From then my progress just seemed to get stronger and better throughout the mapping process. We were able to regain functions in my hamstrings, my quads, my glutes, my calves and ankles, which very quickly enabled me to hold my own body weight, and for a short period of time, for perhaps up to about a minute, and then was able to, in a walking frame and harness, start to learn the process of actually taking steps, from which we went on to then actually learning how to walk in a walking frame with the aid of a walker. By the time I left Bangkok on the 30th of December 2015, I was quite able to use my motor functions. I could stand, hold my own body weight and, as I say, walk in a walker quite comfortably. So again, for anyone in my position from 40 days previous, never being able to feel anything or move any of my motor functions below my level of paralysis here, for that to happen again is priceless, really. From then I've done a lot of rehabilitation at home, and the aftercare that I've received from the therapists here has been, extremely helpful. Throughout that 10 months, I've been able to speak to my therapists very easily on a daily basis at times, or just as and when things have progressed, once I've tried new things, and I've done a lot of training at home. But ultimately my goal was to return to Bangkok to to pursue my dream of actually ably walking unassisted, which is why I've now returned here, and I've been here now for just over 5 weeks. And in those 5 weeks, I can honestly say I've probably gained more in the 5 weeks than I did in the 10 months on my own, just through to the level of rehabilitation that I've received here, to the point where now, through further mapping, I'm now no longer using the hoist or walking frame to walk, and now began the process of actually walking unassisted in that sense, with just the aids of parallel bars. And just from our session today, we actually moved on to then standing in a walker, totally unaided, to then hold my own body weight to start taking steps. It is a long road, and if it was easy, everyone could do it. But at the end of the day, it's a process, and it's something that is available to anyone. And I'm certainly not Superman or the Terminator, and everyone can do it if I can do it. And if anyone obviously has any inquiries, there is a very helpful website on Epidural Stimulation now, and there's also a YouTube channel which has some very useful sort of videos and information there that people can read and do some research at home in their own free time. And from my experience, I still have about 8 weeks left here, by which time we're hopeful that I will be able to leave here walking unaided, or at least in a walker, and then I will continue on with my own personal mission to walking, which hopefully I will not be the first, and there'll be many more who can follow in my footsteps, or possibly even get there before me, who knows. So I think we'll take some questions now, if anyone has any questions.
There's a question from Robin to Dr Nasir. They're a bit, wanting more information about what you mean about mapping after the surgery.
Well, mapping is a comprehensive process. As I mentioned, before we do the surgery, we will record the electrical activity in the patients with complete spinal cord injury or incomplete spinal cord injury, and we will use those electrical intensities to operate the device basically. So the therapist is a hard work for everybody. It's hard work for patients, it's hard work for doctors, and it is hard work for therapists. Based on those electrical activities before the surgery, we are able to operate the device. Basically, we are able to find specific intensities and specific frequencies the different muscles are responding to. So we put everything on paper, and we install some specific programs in the device which patients can use back home. For example, if patient wants to take steps, so there is A program. If patient wants to stand up, there is B program. So this process is called mapping.
Okay. Another question about, can you treat incomplete injury? And also, who is the sort of ideal candidate for this type of treatment?
Well, it's actually difficult to give a general answer, but most of the patients they are candidates for epidural stimulation. Ideally, patients with lower cervical spinal cord injury, from T5, T4, T5, T6 to up to T9 spinal cord injury, they are generally a good candidates for this device. And device works the same for both complete and incomplete spinal cord injury patients. The mapping process is actually different for complete and incomplete spinal cord injury, but the surgery and the treatment is exactly the same for both types.
Another question about the mapping. When the patient receives the mapping, would they be lying down, or are they standing up and trying to walk whilst the mapping takes place?
Yeah, well, initially patients they would be lying down in bed. We would just simply ask them to move certain parts of their legs, try to move certain muscles. But eventually, so patients actually they start from the bed. and then we put them in hoist where they are able to put some weight on their legs with little bit of support. Then patients are, eventually the improvements are progressive. So from the hoist, patients are able to take few steps with support. Then they are able to walk in the hoist with again, of course, with support. And like Andrew Bell's case, he is at a point where he does not need any support for his upper limbs. He is absolutely able to stand on his legs, and he is able to take a few steps in the walking frame and in the parallel bars now. So this is, the improvements are again, starting from the bed, and eventually the goal is to enable the patients to walk their own.
Okay, George has just asked if someone is interested about this treatment, how would they go about making an inquiry?
Well, again, as Andrew explained, there is a website, epiduralstimulation.com. You can simply send your inquiries. Someone would be in contact, and we would ask for specific information. Again, the evaluation is actually a very, very important part of the treatment. We would ask for specific scans, especially a spinal MRI scan and some operative reports. And it may take few days for us to evaluate all the information, and we will get back to you with a definite answer that whether or not you are a candidate, whether you are a good candidate, and what should we expect in terms of recovery.
Someone's asked about sensation. Any improvements?
Well, the device itself is aimed to restore the motor function. So in the shorter run, let's say a few weeks after the device, we do not expect any improvements in the sensory function. But the thing is that with continuous epidural stimulation, the injured part of the spinal cord is actually being stimulated, and it triggers a natural recovery process. So in the longer run, in few months, up to 6 months, or even it may take up to 1 year. For the stimulation to result in enough recovery of the actual spinal cord, and once you get actual recovery of the spinal cord, patients they get back their sensory function. They tend to have a lot less spasms. They are able to get back their bladder and bowel functions. Like in Andrew Bell's case, he is able to push. He's able to his bladder function is almost 90%.
I'd say my bowel and bladder function has improved tremendously, but even talking in terms of sensory and things like my pain reflex, since I've actually just been here the last 5 weeks, my pain reflexes have started to return. So that's almost a year to the date.
Yeah.
But I find that I'm now using my stimulator I'd say about 20 hours a day. I have it turned on, whereas initially I think you build up, I wouldn't say tolerance, but you build up to the time and you use it more and more to the point where I'd hope I would be able to use it. I'm using it 24 hours a day, and I've noticed over the last 3 months, as I've used it more and more and discussed with Dr. Nasir a few times since I've arrived, that I am starting to see improvements in not just my motor functions, which are obvious improvements, but also bodily improvements. And as I say, I'm starting to get natural pain reflexes, which are coming back. So those are things, even 1 year on, that I'm seeing those improvements to my sort of spinal cord and so forth.
Yeah. So, and those improvements, as Andrew Bell is mentioning, those improvements are not. Those improvements are a part of the actual recovery of the spinal cord. When we closely observe the improvements, and when we compare the improvements to what Andrew's condition was one year ago, so we can definitely see very clear signs that the actual spinal cord is being repaired. And the only explanation we can find is it is because a continuous stimulation is being provided, and this stimulation is resulting in the actual regeneration of the spinal tracts in the injured spinal cord.
Christina has asked about the success rates so far of the patients who have received it.
Well, we are extremely careful in terms of in terms of medical evaluation, again, I mean, most of the patients, they are candidate for epidural stimulation, but not all of them. So definitely we would tell you if you are a candidate or not. And for those patients who got treated so far, it worked for all of the patients. And another thing is that I mean, the surgery is done by a very professional doctor, and we are doing we call it perioperative testing. So actually during the operation, the neurosurgeon is spending actually quite some time in finding the specific and the best location and to get the maximum response. So that is definitely also playing a very important part in the recovery process.
Tishla has asked about the size of the implant and is it painful?
I would say the implant itself is actually, correct me if I'm wrong, on the bottom, on the dura of your spinal cord, so that's not actually viewable. It's the battery pack, which is on this, just on the lower side, above my hip really. It's about the size, it's about that big, and I can sort of feel it, but it is in no way painful. I've had no side effects at all. It doesn't obstruct me in any way, and I certainly have no ill feelings or pain afterwards. I woke up after the surgery and sounds strange to say, but I felt absolutely fine, and it was quite major surgery, but to have that and then 3 days later be doing my first rehab session maybe gives a clear enough answer to say that I was able to have that first session and then the next day carry on and so forth from there. And after returning home, again, I've had no side effects or illnesses from it, but it's probably something that a lot of people would like to know, is that I was told if I did have any problems that I would not have to return to Bangkok. There are actually places in the UK for myself, or I think elsewhere around the world, where if you have an issue with your stimulator, you can then go to the manufacturer, which are used around the world, and you can actually then go and have your sort of stimulator issue looked at. But I know personally I've never had any issues, and as far as I'm aware, again, correct me if I'm wrong, there's never been any issues to date with any other patients. So
no, definitely so far there had never been any issue with the device or with the incompatibility or any other thing. But in case it happens, actually we will be able to provide some sort of remote troubleshoot, and actually the manufacturer also would be able to provide a lot of assistance in most of the countries.
Robin has asked about, you say that you have the stimulator on for sometimes 20 hours per day. I mean, do you need to have it on when you're asleep?
The reason I have it on for sleeping, two reasons. First of all, it's good for stopping atrophy in my legs. So when I have it on a night, it sort of gives there are different settings with your stimulator, and I have it on a specific setting which just gives a very, very slight stimulation to the muscles in my legs. So while I'm sleeping, it's maintaining the size of the muscle mass in my legs, and it's preventing atrophy. But also it's actually it's good for preventing spasms in my legs. So I'm lucky I don't suffer from spasms too bad, but I know, and I've seen many spinal cord injury patients who do. So I suppose for those people, for sleeping wise, it would be a huge benefit. And for myself, again, just for the spasms that I sometimes do get, I do use it for that purpose. But as Dr. Nasir has just explained in detail, it's very good to stimulate the spinal cord for natural regeneration. So the more that I'm using it, the more that I'm naturally regenerating my spinal cord. So I've now got to the point where I can have it on for 20 hours a day, and that's already started to pay dividends for myself.
Is it suitable for C6, C7?
Yeah, I mean C6, C7 spinal cord injury patient, they would make a very good candidate for epidural stimulation. It's quite a good indication actually.
Okay. And I mean, just to wrap up there, Imran has just asked again how to make contact if anyone to have any inquiries or is interested in more information.
Yeah. So there's a epidural stimulation now on the website. Please send your inquiry, and someone will be in contact.
Yeah, and also I know personally I have a dedicated page where people can contact me, which is Andrew Bell Mission to Walk. So if you have any personal questions for me and my experience, then please feel free to message me on that site. I'd just like to thank everyone for tuning in. This will be the first of probably a few sessions that we're going to be doing over the next few months during my stay, I'm sure going forward. So we will certainly keep everyone posted over the coming weeks for any future ones. And in the meantime, if you have any questions for either myself or Dr. Nasir or anyone in the team, please feel free to sort of log on and let us know.
Thank you.
Thank you.
Thank you very much. Thank you.